right, party people, it's Wellness Wednesday, and we are dedicated to working on our physical and mental health all year. Joining us this morning, the one and only Dr. M.J. Collier. Dr. Collier, we happy that you're here today. All over the news this morning, and there are headlines about the intermittent fasting can potentially be harmful to your health. How you feeling, man?
Well, I'm feeling great, Ricky. Thank you so very much. That frog is finally gone out of my voice, mostly. So, and the First Lady has now allowed me to kiss on the cheek. So we are good from that perspective. So good morning, Ricky. Rock T. Special K, Gary with the T, and to the ladies, Maria Moore and Debret. So, Ricky, thank you once again for the opportunity to bring healthcare information to the listeners of the Ricky Smiley Morning Show. So good, great topic. We're going to continue in the discussion that you guys were having earlier about the weight loss special, Shane Blaine, and the weight loss resolution. So, Ricky, we've gone full circle. At first, everyone was glad to say that they had lost weight using the new injectable medications, semaglutide, which goes by the brand name Ozempic and Wegovy, and tirzepatide, which goes by the brand name Mounjaro and Zepbound. Then the backlash started over people losing medicine. People say people were taking the easy way out, and they needed to change their lifestyles and dedicate themselves more to their health, et cetera, et cetera. So then people started denying. Not me. That's not what I'm doing. I'm working out 7 days a week and all of those sorts of things. But with such dramatic weight loss, Ricky, 15 pounds or more for every 100 pounds of weight, the transformations were undeniable, so people couldn't deny. Now, we've always had celebrities such as Shaq and Charles Barkley who admitted to using these medications. Men seem to not have any problem with it. And now Oprah came out with her special, and she finally admitted to using these medications. So you see that they work, and they have great results. Now, Ricky, these medications were initially prescribed for diabetes. They lower blood sugar and lower A1C levels in an amazing fashion. It's almost like a person doesn't have diabetes anymore. Doesn't cure it, but basically makes you as if you don't have diabetes. But they started noticing other benefits in those people, decreased heart attack and stroke rates, and improved kidney function. So now the FDA has approved indications for those meds for people who are not diabetic. And you got cardiologists, who are heart specialists, and nephrologists who are kidney specialists who are treating patients with these medications. Now, why does that happen, or how does it work? We don't know. The exact mechanism of action is not known, but the benefits are very well documented with decreased heart attack, decreased stroke rates, etc. So the side benefit is the weight loss. So if you're overweight and your journey to good health includes these medications, you will have health benefits that will add years of good health to your life. Now, so intermittent fasting, Ricky, great documented that it works wonderfully. I recommend it in my weight loss clinic. There are two options that I recommend. Eating 5 times per day, which is breakfast, lunch, and dinner, and a snack in between the two, or intermittent fasting. Documented that this works wonderfully and gives you great benefit. The issue is that people need to stay on a fixed schedule and not breaking it up. Now, intermittent fasting means various things. Now, the plan that I'm talking about is basically eating everything that you're going to eat in 1 8-hour period. Okay, there are other intermittent fasting where people don't eat for 3 days or don't eat for 1 week or go on the hot pepper diet and all those sorts of things. That's not the type of intermittent fasting I'm talking about, and those can be harmful to your health, causing everything from acute kidney injuries to dehydration. But a regular program of only controlling when you eat, it's not really important what you eat. Now, that doesn't mean you can eat Krispy Kreme donuts all day. It does mean that if you eat reasonably in that 8-hour period, 9 to 5, 8 to 4, whatever works in your lifestyle, that you will have good weight loss with that and maintaining your health.
All right, that's good stuff right there. Let's go to the phones. You're on with Dr. Collier. Good morning.
Hi, yes, I'm Sharon calling from Columbia, South Carolina. My question is, I have a question about cortisol. I do have an endocrinologist appointment coming up, but I'd like to know what forms of treatment are provided for those with high stress levels of cortisol in their system.
Okay, cortisol, thank you so much for calling in. Cortisol is the stress hormone that results in increased predominantly abdominal fat, so that belly fat responds to that stress hormone. And there are, de-stressing, things that help de-stress you, controlling inflammatory disease states such as high blood pressure and diabetes. And there are direct treatments to lower cortisol, but that's really pretty aggressive, and you probably would not qualify for that unless you had very difficult to control high blood pressure or your blood sugar was totally out of control. But But again, the main thing is just controlling those inflammatory disease states, which are part of what's called the metabolic syndrome, and decreasing your life stressors. Amazingly enough, one of the biggest stressors that we have is sleep deprivation. Most people are getting less than 6 hours of sleep per night, and even if they are sleeping, they're not getting 6 hours minimum of restful sleep. Nobody gets 8 hours of sleep, so 6 hours is what we strive for, but it needs to be good quality sleep. So they'll also test you for things like obstructive sleep apnea as well.
Can't sleep, got to pee all night. All right, you on, Dr. Collier? Good morning.
Calling from Akron, Ohio, and my question for the doctor is it normal to experience extreme pain after getting an epidural when giving birth?
But she done called in from a doom buggy.
from Ohio, O-H-I-O. Of course, there's no such entity. Pain is always an indication of pathology. There's something wrong. Childbirth itself is very stressful on a female's body. And nowadays, we expect a woman to have a baby and go back to working in the fields like the next day. That's not it. There's a substantive and significant recovery time that may or may not be related to having the epidural. But the childbirth process itself, particularly, even if it was a C-section, if it was a vaginal delivery, the trauma to a female's body is something that it takes a while to recuperate from, and it also depends on what your health status was prior to delivery. So if you were not in good shape or overweight or having some issues with your health prior to delivery, going through the going through the birth process is one of the most challenging health challenges that you will have in your life.
All right, y'all, with Dr. Collier. Good morning.
Hi, I'm calling from Georgia, and I am calling regarding my gallbladder, just trying to see are there any other alternatives other than gallbladder surgery dealing with your gallbladder. I have sickness in the right side of my abdomen, and just want to know, are there any health things or anything to do pertaining to the gallbladder other than having surgery?
The gallbladder's purpose is to hold and store bile. Bile is used to digest fat. So if you eat a fatty meal, then your gallbladder squeezes kind of like a perfume atomizer, and then it pushes bile into your stomach, and that bile, which is very toxic, it's very caustic, and it helps to dissolve fat. Now, so one of the main things to do is just avoid fatty fried foods, and that will limit gallbladder symptoms. If you have a small gallstones can be made of calcium or uric acid, and uric acid stones sometimes can be dissolved by medications, but calcified stones, they're not going to do that, and cholesterol stones, they will have to be physically removed. A large stone, believe it or not, is actually a better option for you because it can cause temporary obstruction using what's called a ball valve effect, and just the position of your body, you can move that and then it'll give you relief. But if you have a small stone that's obstructing the bile duct, then the only option for that is surgery. If that bile starts to back up into your pancreas, it can result in pancreatitis and a lot of other health problems. So the great thing about the gallbladder surgery is now they go through your belly button, it leaves 3 tiny little scars, and it fixes the problem almost instantly. Without a gallbladder, though, you will be susceptible to explosive diarrhea if you eat high caloric foods like a high-fat meal, because there's no bile to help dissolve that. And so you can't go to, the place where all you can eat and make it out of there before you have to run to the toilet. So you have to be very careful about what you eat and how you eat it once you've had gallbladder surgery.
Turn into a weapon after that. Dr. Collier, let everybody know how you can be reached.
Okay, Rickey, I can be reached on all social media at AskDRMJ. And I do want to make note that the Atlanta Medical Association is hosting their annual scholarship fundraiser this Friday here in Atlanta, 7 p.m. at the Foundry at Pier to Mill. Rickey, the average cost to attend medical school now is about $206,000. And our purpose, our passion is to help struggling students attend medical school who are smart enough and they have the desire to attend, but they're financially challenged. So the Atlanta Medical Association's job is to raise funds to help support the education of those students. For more information, go to ATLAtlantamed.org and come hang out with the doctors. Come meet doctors that look like you. Meet new people. Join us on Friday at the AMA Scholarship Ball. So, Rickey, these are the opinions of Dr. M.J. Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Remember, go to my YouTube channel at Ask Dr. MJ for more information on staying healthy, and look at my thousands of videos on various healthcare topics. Go to the website, lifeforjobs.com, for more information on supplements that can keep you healthy. One more thing, Rickey.
Yeah.
stay. Don't you dare go away. You listening to Dr. MJ on the Rickey Smiley Morning Show. That was for Rock Peasy.
Come on with it. The
We
hip
love
hop
that,
doc,
Doc.
baby.
We love when you do that, Dr. Collier. Boy, if you don't sound like Cool Mo D. I love it.
The original.
Dr. Yes, sir. Dr. MJ Collier, y'all. Yes, sir. It's Rickey Smiley Morning Show.